Dear church family, the current state of the COVID-19 pandemic depends on where you live.
We're joined now by the World Health Organization's lead expert on COVID-19, Dr. Maria Van Kerkhove. Doctor, thank you so much for joining us this morning. You lead the WHO's Emerging Diseases Unit. You've been on the front lines of this fight since the very beginning. After 7 months, more than 15 million cases worldwide. Where do things stand? Are we controlling the virus, or is the virus controlling us?
Right now, the virus is controlling us in many parts of the world. We're seeing quite some worrying trends in many parts of the world, where many countries are seeing, really increased transmission, intense transmission. Much of the Americas right now are really in the thick of it. But we do see signs of hope. In some countries, they have been able to control the virus. This virus is controllable with the steps that are outlined with this whole comprehensive approach that we've been talking about since the beginning of this pandemic. And we've seen many countries have success. So I think there is an element of hope that everybody needs to understand. Even countries that are really overwhelmed right now can turn this around. They can and they will turn this around.
Let me press you on that, because almost half the world's cases now are coming from just 3 countries, the United States, India, and Brazil. We have seen the curve flatten in parts of Europe and Asia, although there's some resurgence in some of those countries right now. How do you explain the difference?
Well, there are quite some differences in countries in the way that they've responded to this pandemic. What we do know, what works consistently in high-income countries, low-income countries, north, south, urban, rural populations, is a comprehensive approach. It's this quick isolation, identification, care of patients, of cases, even cases that have mild disease or who are asymptomatic. Putting them in isolation prevents them from passing it to someone else. Contact tracing, finding contacts of confirmed cases, putting them in quarantine, whether this is in a special quarantine facility or quarantining at home, empowering your population, letting them know, where is this virus, what can you do, what can I do to prevent myself from infection, making sure that this is an all-of-government approach. This is not just a health sector response, this is an all-of-government approach, meaning that every sector needs to be involved. But I think most importantly, as I've already mentioned, is really empowering communities, empowering individuals so that they know what they can do to prevent themselves from getting infected. And this is the package of interventions. It's physical distancing, it's cleaning your hands, it's wearing a mask where appropriate, it's being vigilant, being alert, being aware, and really being kind.
In California, we are not only dealing with the pandemic, we now have wildfires, which is causing very unpleasant air quality issues.
Progress being made across the spectrum on hospitalizations, ICUs, positivity rate, particularly over the 7-day period, and continuing vigilance in this very difficult period where we're battling this pandemic as we're battling these wildfires all up and down the state of California. Just briefly, I want to continue to remind you how deadly this disease is, and while we reported, it's absolutely essential for no other reason than to protect you from air quality, but to also protect you and others from the spread of this virus. This pandemic has not gone away. It may be out of the headlines in the state of California because the wildfires have moved into that current occupation of running the daily news feeds. But wearing a mask is foundational in terms of continuing to mitigate the spread of this disease, mitigating the damage to your health as well associated with the smoke. Encourage you to physically distance as always, wash your hands, and of course minimize the extent possible.
Take care of yourself and take care of each other. God bless you.